Welcome to today's program, Protecting the Vulnerable During the COVID-19 Pandemic, Part 1 of 2. COVID-19 first appeared in Wuhan, China, at the end of 2019. Since then, it has become a global pandemic and radically changed our lives in unimaginable ways. Many countries have implemented lockdowns of various lengths and closed their borders. The healthcare system of nearly every nation is experiencing unprecedented pressure, and people are enduring a huge amount of stress and anxiety. This coronavirus can produce a wide range of clinical manifestations, including high fever, chills, cough, shortness of breath or difficulty breathing, fatigue, aches, headache, sore throat, congestion, running nose, nausea or vomiting, diarrhea, skin rashes, discoloration of the fingers or toes, and loss of taste or smell. On average, it takes 5 days or up to 2 weeks to develop symptoms that can range from very mild to extremely dangerous. COVID-19 can create an unusually high level of viral particles in the upper respiratory tract, especially the nose and mouth. Thus, it is much easier for the virus to be spread into the environment when people sneeze, cough, or talk. Meanwhile, it is infectious even in pre-symptomatic and asymptomatic individuals. This peculiar feature makes the disease extremely difficult to confine. Older adults, those 70+ years of age, and people who have underlying medical conditions such as a non-severe lung condition, heart disease, diabetes, chronic kidney disease, liver disease, as well as those with a weakened immune system or are very obese, are assumed to be at moderate risk for becoming seriously ill if infected by the coronavirus. In the UK, the National Health Service, or NHS, categorizes these people into the clinically vulnerable group. Other individuals fall into the clinically extremely vulnerable group that is at high risk of becoming severely ill from COVID-19. These include persons with an organ transplant, cancer, severe respiratory condition, on immunosuppression therapies, and pregnant women with serious heart disease. Worries and fears are in the hearts of everyone during this time of unease. This is especially the case for medically vulnerable populations who tend to carry these emotional burdens significantly more than healthy individuals. Here are some tips from American psychiatrist Dr. Felicia Wong on helping elders with medical issues to cope.
Older adults with health conditions who are not leaving their homes at all right now may feel lonely, especially if their daily routine included regular interactions with family, friends, or care providers. I'd like to share some simple ways you can help ease their concerns and raise their spirits during this time. Check in with them frequently by phone, or even better, by video. Seeing your smile and face is calming and creates connection. Ask how they are doing and make sure they have what they need. If they need you to get groceries or other essentials, take the opportunity when you drop them off for an in-person chat, but at a safe distance of at least 6 feet. Encourage your loved one to stick to their routine as much as possible, especially their sleep schedule, eating, medication, and appointments. Support them in staying in touch with their friends and family and do what they can to help one another. Suggest some creative ways to stay connected, such as video lunch dates, book clubs, online bridge, or exercise sessions. This might even be a good time to explore a new hobby. Encourage them to limit their exposure to news. In these times, media reports can be alarming, so checking the news at a specific, limited time each day helps to stay informed without becoming overwhelmed.
Though lockdowns have been lifted in many countries and people are free to spend time outdoors, some still hesitate to go out because their infection risk is high. Natasha Howard in the UK has Crohn's disease, an inflammatory bowel disease, and is taking an immunosuppressant for the condition. She belongs to the clinically extremely vulnerable group and, per government guidance, shielded or avoided living home with her partner Matt Murray for more than 100 days. The couple advocates for a shielding hour in Britain, so people like Natasha, who are at high risk, can have a designated time to get out safely once a day without worrying about walking into crowds of people. The group National Voices, which represents hundreds of health and social care charities, is also joining the campaign to urge the British government to consider this issue. Natasha's initiative reminds us of the tough situation many people face daily. Fortunately, there have been some responsive measures implemented. For example, in England, for the people who are clinically extremely vulnerable when shielding at home is required, they can register online to have free government-provided food boxes with essential groceries and medicines delivered to their homes. Some supermarkets in the UK and USA have launched dedicated shopping hours for medical personnel, the elderly and vulnerable customers, to help limit their coronavirus exposure. You may check with your local store to confirm the availability of this service if needed. We wish more and more companies join this movement to better safeguard the people who need it. National governments have posted public health protection measures and assistance information on their websites to help their citizens cope with this crisis. The Centers for Disease Control and Prevention, or CDC, a U.S. government agency, provides practical advice to those with an underlying medical condition to follow during the pandemic. Here is an abbreviated list of recommendations for such persons from the CDC website. Continue your medicines and do not change your treatment plan without talking to your doctor. Have at least a 30-day supply of prescription and non-prescription medicines. Do not delay getting emergency care for your underlying condition because of COVID-19. Call your healthcare provider if you have any concerns about your underlying medical conditions or if you get sick and think you may have COVID-19. During the pandemic, such populations not only are in higher danger of being infected by coronavirus, but also may not be able to seek timely treatment for their condition due to the influx of people requesting COVID-19 related medical aid. As long as the number of infected people and death toll is increasing worldwide, we all have the responsibility to take necessary precautions such as social distancing, wearing masks, and practicing personal hygiene. It helps protect us from possibly being infected and better ensures that we do not spread the coronavirus to others if we are asymptomatic. Our beloved Supreme Master Ching Hai also reminds us of the importance of safeguarding ourselves from COVID-19.
Even the WHO keep telling people it's not safe, okay?
Yes.
You just have to really protect yourself. Not safe yet. It doesn't go away. It's keep coming.
Please take this virus really seriously. It hasn't gone away. It's very much there. Please respect what the public health folk are telling you to do. They're saying it for a reason. Please protect yourself and others, maintaining physical distance, wearing a mask when you're in public places, and if you're at all unwell, don't go out. It's really important that we recognize that this virus is dangerous and we've all got to work to get on top of it. I really ask everybody in the US, and indeed everybody everywhere, to go on taking this virus seriously, please.
But I say all this for people.
Yes, Master.
So they be more careful. It's not fun to be sick, especially this time.
Yes, Master.
It terminates you and tortures you before that.
All of Supreme Master Ching Hai's tips for protection during the COVID-19 and any other pandemic are free for viewing and download at Master's Tips on COVID-19.com. Please join us again next Saturday, November 14th, for Protecting the Vulnerable During the COVID-19 Pandemic, Part 2 of 2.